Welcome to Frontline. We continue to celebrate our frontline workers. We've been focusing a lot on health and those in the security services, the efforts they put into saving lives during pandemics. Yesterday, government announced a special package for health workers at the forefront of COVID-19 fight in the country. On Frontline today, we speak with Dr. Yorke. He's a Greater Accra Region Chairman for the Ghana Medical Association. Dr. Yorke, thank you so much for joining us today. He's joining us via Zoom. Dr. Yorke is the Greater Accra Chairman of the Ghana Medical Association. If you've monitored the conversation, they've had their own concerns with the lockdown. They've had their own issues with PPE, so we'll be talking to them. But the focus really is to celebrate the efforts that they put in. Ghana has not been to the, we're not at the level where other countries are. We certainly hope not to get there. But in the meantime, we're celebrating our frontline workers and we're letting them know that we're here with them. We're in this together. Let's see if there are some more messages. This one says, please, my biggest story is the frontline workers. I'm grateful to them and all stakeholders, as well as all who have loved to stay at home and ensuring social distancing. Please, who buries those who died through the COVID-19? Is it the government or their families? Morris from Akosombo is asking that. Morris, I don't have the answer. I'll try and find out if the GMA can give us that answer here on Frontline. But thank you so much for showing appreciation to our frontline workers. This message said, it's an event I witnessed in the night. My wife was in labor at the Holy Family Hospital. A woman equally in labor was rushed to the same ward by a stranger. When the doctor asked for the husband, he was somewhere else chilling with another woman, whilst his own wife was struggling for life. Indeed, relatives came later. Well, I'm not quite sure what the story is. If you're celebrating a frontline worker who came in handy at that time, thank you very much for sending your message in as well. Okay, only Allah has a reward for our health workers. That's Nazib texting us from Yendi, all the way from Yendi. Nazib, thanks for texting us. How is Yendi and how is coronavirus going out there with all the curfew that you've had to endure in the past? Certainly good that we're back in normal times there. How is Yendi at the moment? This message says, Gifty, I want to know, do private hospital staff and private ambulance drivers fall under frontline workers, and do they qualify for the insurance package? Well, the last time we spoke to the Association of Private Health Workers, we were told that they've been asked to send in a list to government. We'll be following up with them to find out whether that list has been submitted to government and what became of it. But we do know that the health minister also at the press conference said they weren't really sure because they were still working things out to find out who actually qualifies to be a frontline worker. There has been a directive from the Office of the Director General of the Ghana Health Service that all pregnant women and nursing mothers should be excused from duty, but some hospitals are not adhering to it, with the excuse that the hospital management has not been served any official letter. Please, what has been done about this? It's a question I would like to put to the Ghana Medical Association. What do they know about this and what are they doing about it? Hopefully I won't forget when we raise Dr. Yorke back on the line. Let's take a very quick break. We'll be back with Frontline. Welcome back. Many thanks for staying with us and sincere apologies for that. I do have Dr. Yorke on Zoom with me. Dr. Yorke, it's good to have you. Good afternoon.
Surely, a little technology challenge, but that's okay.
I know, right? It's good to have you. You look like you're all dressed up for work. Are you working?
Yes, I'm running a late afternoon shift. So immediately after I'm done with you, I'm off to work. How's
it going?
Well, it's been stressful, you know, like everybody else, you know, you are not sure what is in stock for you once you step out to work. And especially for us who are frontline, that's even more, you know, traumatizing sometimes. You know, I'm preparing to leave home and I'm asking myself, what am I going to meet? Who am I going to meet? Is it a possibility that I may come in contact with a patient or even a co-worker who may have the condition? And so, it has impact on us psychologically, but we are praised up for it.
And that actually adds to the physical, scare of it all, because this is working in your brains, this is working in your mind, the uncertainty alone, plus the fact that you get home, you get to work, and now you get to be confronted with the reality on the ground. I mean, how are your colleagues taking this?
Well, we are putting up brave faces, I must confess. But when you speak to people one-on-one, you sense a certain level of fear in what they say, because we've seen co-workers being infected, both doctors, nurses, and other health professionals. And we've seen some succumb, unfortunately, to this COVID-19. So it is real, and that's, put some psychological stress on us. However, we, are committed to delivering what we are expected to do. Besides that, I'm sure you've heard about this constant, complaint about inadequate PPEs, and that is a present and continuing concern that we have. And that also adds to our level of uncertainty and psychological stress.
I'll talk about the PPEs on its own, but before that, I just want to find out, do you receive, or is there a sort of arrangement to give people like yourself some psychological support or some emotional support whilst we're in these times?
Well, I've been lucky in the institution where I work. Management has organized a training session for us, the frontline workers, and they've taken through us what to expect and how to deal with psychological stress. And they've also, put up a team that is on standby for us to access when we think that we need some form of support. But that is where I work. I work in Kolebu, and it is not the case. As a chairman, I've spoken to a lot of the reps from a lot of the hospitals in the region, and that's not the case. And at this stage, I'll implore all health facility managers that they should take it seriously and try and organize similar, things for their workers, because it's not easy. It's not just being there to work, but the doctor, the health professional must be in the right frame of mind to be able to deliver what they expected to deliver.
Let's talk about PPEs. It's been one of the biggest issues since we started this conversation. I mean, when our numbers were fewer, it wasn't a big part of the conversation. Now we can't run away from it, and people are actually predicting, like, we don't know what's going to happen next. Even at this stage, we're complaining about PPEs. What really is the problem? How has it been resolved with the GMA stepping in and all of that?
Well, I don't even think that it wasn't a problem from the beginning. It has always been. We didn't prepare, quite enough to be able to, manage these, what we find ourselves better. I'm sure we thought, it is a disease from China, it is a disease of the white person, it's a disease of somebody from a foreign land. But little did you know it is clearly something that can come to us. So it has come, and PPEs continue to be a challenge. I know that the government has taken initiatives, to supply, to procure, and recently they've even engaged some local manufacturers to produce some face masks. But I must say that effort, unfortunately, albeit late, is also not enough. We continue to hear on a daily basis from various facilities, inadequate PPEs, and that makes people uncertain, and sometimes patients may suffer because the health worker may not be prepared to risk his or her life to attend to a patient if they are not adequately protected. And I know that many doctors, I can speak for on authority, that they supplement what the institution gives them to be able to adequately gown and be protected, to be able to attend to patients, when they have to don these PPEs. So it's a challenge.
One doctor I spoke to about PPE said, I am buying it myself. I'm buying face masks myself. But for how long can I keep using my salary to buy PPEs? We certainly can't live like this for long. What in your perspective, and I believe in the GMA's perspective, can be done about this problem with PPEs, especially since it's not going away?
It is not, and the other scary bit is the increasing numbers, and that will mean that, you know, the demand will continue to rise. And so the first point for me, honestly, will be to identify other local industries and interests that will be able to supplement their production. The other thing too we can do is to approach foreign sources. I know that, you know, it's in short supply elsewhere, but this thing we shouldn't give up. We should still try. And at this stage, we also call on individuals and well-meaning Ghanaians, private institutions, to come in and help. I know that people are trying, but I would say Oliver Twist we asked for more. It is not a comforting situation we find ourselves, and you know, that has been on the lips of everybody. And it scares me that if we are not careful and we get to a certain stage, both the health practitioner and the patient may be in danger, and you know, it may not be good for us. So I think that heads must come together. GMA has started, but we've been engaging government on finding solutions. But I think that they are trying, but they should try harder. And the individuals should also step in and to help. Otherwise, all of us, you know, may suffer for this shortage of PPEs that we find in the system now.
Well, if you're hearing here on the front line, you certainly want to put in a hand of help. I'm sure you can reach out to the GMA, you can reach out to hospitals, you can reach out to authorities, anyhow you want to help. I know that companies are helping, and we'll be celebrating some of those companies as well as we go along. But please, as you've heard the plea, do step up. Doc, I want us to talk about frontline workers. There's been a big debate about who qualifies to be a frontline worker, especially when President Akufo-Addo announced the packages for them. As I speak with you now, I'm receiving a lot of messages right here on this show. People are asking, are we clear about who falls within the category in these times as a frontline worker?
Quickly, let me add, you know, before I just answer your question about the PPEs, you know, GMA on its own, we've put up a fund that, you know, we are soliciting from well-meaning Ghanaians. And so far, we've distributed, you know, PPEs to many treatment centers and institutions in Ghana. And I also know that the Women's Wing, the Medical Women's Association, is also leading another, you know, crusade, you know, to provide nose masks locally produced, and that's also been ongoing. And so this is some of the things that on our own as GMA we are doing. But quickly back to your definition of who a frontline worker is. You know that, you know, it's always been difficult. If you ask government sources, the definition keeps changing. And remember the last fiat that the president issued, you know, it says, you know, those who work directly with, you know, COVID patients, the next day at the Minister of Health or the Director General changes, and GMA is continually engaging them. And what has also happened that because of this varying of the definitions of who a frontline worker is, the government has been issuing, you know, about 3 or 4, you know, instructions to the controller, asking them to implement, you know, what they are thinking who a frontline worker is. And certainly on my mind, every health worker that comes in contact or has the potential to come in contact with a COVID patient is a frontline worker. Because the person sitting in the emergency room, the person sitting on the ward, the person at the clinic, the person in the laboratory, the person who is taking patient's file, somebody may walk up to the person and say hello and call for, you know, so everybody is at risk. So I think government should be able to define on the broader sense so that it limits this agitation on the ground, and therefore everybody's mind will be clear and they will rather concentrate on what they are trained and required to do as frontline workers.
Doc, in the coming days, I think we'll get a chance to talk more about this. But before we let you go today, I'd like to find out how this is impacting your relationship at home, with your spouse, with your children. How has COVID-19 changed life for you?
You see the broad smile on my face.
I do. I have one as well.
It's enormous. Look, we are, apart from the personal, psychological stress and the physical stress from working long hours, you know, wearing those difficult PPEs, which you feel like you're an oven, we're having to stay out longer, so you miss your spouse and your family, your loved ones at home waiting for you. You come and there's a medical bucket at the door. You must wash your hands before you enter the house, as if you're a stranger. You must go straight to the shower with antiseptic soap. Your clothes must go into the laundry. You are having to spend more whilst you are earning less. You and I go to the market and you know that everything else has increased. All consumables have increased. So it has told both on us as individuals and as a family. And what we are hoping for is that this pandemic passes over us quickly. But as soldiers, let me just add, as GMA, we are committed, in these difficult times to stand up and be counted. If it was a war time, we'll count on the soldiers, but this is a pandemic time, and it's a time for health workers to prove our merit, and we are committed to do so. What we only ask is the support from, the government to provide us what we need, especially PPEs, and that the general public as well support us with the equipment and the accoutrement that we need. And also let's, in our own ways, keep safe by practicing what hand washing, using hand sanitizers, staying home when you don't have to, and ensuring that you observe the required social distance. I'm sure when we do these things, we can bring the pandemic under control, and Ghana will be better for it.
Is that your wife's portrait right behind you?
It is, so I'm getting inspirations from it before I step out.
Oh, wow. If you could just shift your head a little bit, we'll have a clearer picture if you want us to see, of course. Oh, there. Yeah. She's a pretty woman. Our regards to her, and thanks to her. Thanks to her for giving you that inspiration and also being there for you in these times where you need a lot of psychological support and emotional support. I believe your kids support you as well.
Surely they do. They have concerns of their own, but I assure them that I must do it for country. So they are all in support, and thank you too for the opportunity.
Dr. Yorke, the next time I come to you, I'm really looking forward to hearing some very interesting stories, if they are, of the experiences, the individual experiences, the unique individual experiences you've had in these times of COVID-19. I hope we'll get the chance to do that one of these days.
Surely.
Thank you so much. So this is Frontline, and what we do is celebrate our frontline workers. Dr. Yorke is one of the persons we're celebrating today. You've heard him talk about the psychological stress that most of his colleagues have had to deal with himself, but there is some sort of support, but not every hospital will have that support. So you can appreciate the stress they're going through. PPEs, of course, continue to be one of the biggest problems. If you can, do step out and support these organizations. Dr. Yorke is the chairman, the GMA chairman for Greater Accra region. Thank you so much once again for bringing us into your space and coming to people's homes today.